more reds, yellows, reds, yellows, 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 a lot of reds, caps, reds, all caps. So we know that's a serious issue yet again. Okay, some more yellows. So not one green, which is really interesting. And of course, you joined the call tonight knowing we were going to be talking about some of these challenges. So I guess it stands to, one could reason that that's why you're on the call, and I'm so glad you're here. Okay, so let's dig in to this. A couple things that I wanted to share with you. Look at the first one. Just interviewed a hygienist who graduated. She started her first job at another private practice in May. She's asking for more money than my veteran hygienist is making. I offered her a starting rate due to her lack of experience. I told her to think about it and get back to me. I don't think she'll take the job. But what is she thinking? At the rate she wants, she'd better do 2 profis per hour. Like, that's the harsh reality that we're running into in some of these practices. Is it's almost impossible to maintain profitability with the reduced insurance reimbursement. Now, I get it. Insurance is the bad guy. And do I believe hygienists should be earning 6-figure salary? Absolutely, I do. I believe hygienists who understand what we teach and maximize their roles are worth that. Here's another one. A hygienist deep in the application process for an office looking to expand to a second hygienist gets to the point of receiving an offer. Same offer that the other hygienist currently employed already makes. More than she currently makes. This is the only applicant we have to choose from. Hygienist says, I received a much higher offer from another dentist. What is your highest offer? So the challenge to me with that is that takes something that really should be a very important decision from a relationship standpoint and turns it into a transactional standpoint. We don't want our hygienists and the hygienists that we hire to feel like hiring them is a transaction, right? We want to hire someone who we think is the best possible fit to take care of our patients in the best possible way. And I think it's somewhat off-putting when we approach it that way. I've seen evidence that the market will adjust when things are unsustainable. We see some doctors advocating for a hygienist-free model. Here's one of those doctors. I've had a few people message me about my practice transition to a hygienist-free model. So far, it's all been positive, okay? On the other side, his comments continue. I think we all get in our way. We say hygiene is beneath us, like we're better than that, and our patient can see someone more suited to treat them. That may be true, but in this day and age where insurance will often pay less than your hygienist's salary, the hygienist becomes a luxury. And we didn't do this. They did. They demand a 6-figure salary and do very little to ensure they make it back. Some do, but the vast majority don't. And if we ask them to, they just cut and run to the next sucker willing to open their wallet. Now, do I agree with those statements? Absolutely not. But as I said, we're going to have some uncomfortable conversations tonight because this is reality. There are some states that are moving to allow assistants to deliver local anesthesia. Assistants are being licensed to scale. We've got to be careful, hygienists, that we don't make ourselves irrelevant. Okay, so we've got to have a deeper understanding of what's happening. Can you see why I say there's a growing divide? Now, granted, we absolutely don't advocate for a hygienist-free model. We believe that doctors are the most productive and most capable when their hands are on a handpiece, doing things that only a doctor can do. Hygienists, same thing. We want your hands on the scalers. We want you taking great care of your patients. But we've got to find a way to make it workable. Okay, so what to do? What do we do here? Right? Same thing. High wages have made it really, really difficult to hire people. Just came on the page to see hiring advice. And I see all these posts about not finding hygienists. I guess we're all currently competing to get a hygienist. Someone says, I'm in Michigan too. There's a shortage of hygienists. It's very hard to find good people. We tried to hire and have horrible luck. Many hygienists just don't show up to work or quit after a short period of time because they found someplace else, right? So these are very real challenges that we're having. High hygiene wages, difficulty with hiring. How do we solve it? Okay, the good news is we actually can help you solve it. Okay, the focus should be, if we've got to have high hygiene wages, we've got to find ways to increase our production. Again, the good news is we can do this the right way by elevating care for patients. There's no need to ever talk about finding or doing unnecessary services. There's so many things that our patients desperately need, right? So let's dig into that. You know, when we talk about increasing production, we talk about a couple key systems. We want to provide a higher level of care for patients. That's how we increase production. We also focus on minimizing the no-shows, cancellations, and open time by embracing our 8 R's. I'm going to talk more about that in a moment. And then also another key way to increase production and compensate hygienists at the highest possible level is to have them earn a bigger future by providing a production-based compensation model. Okay, we don't want to have hygienists demanding a bigger future. We want to give them the opportunity to earn it. And in my opinion, that's a big difference. Okay, there's a big difference between those things. So when we look at these things, providing a higher level of care, we often talk about maximizing the role of a preventive therapist. And some of the keys to that are listed here before you. In many practices, we don't see patients accepting or understanding the value behind fluoride. The research behind sealants has changed dramatically. Bonded protective agents are a great solution for patients that have exposed root surfaces that are also high risk for decay. We're seeing an amazing new opportunity for a new product, a new service that even has an ADA code attached to it, guided enamel remineralization. In many practices, these are for the watch areas, the incipient lesions. Isn't it an amazing thing that in today's world, we actually have technology that can help patients heal those cavities? Now, if you would have filled it before, chances are you're still going to fill it now. But on those incipient and proximal lesions that we would have watched, we can now offer a solution. We're seeing more opportunities brought to us by artificial intelligence and by higher level, better quality digital radiographs. So all of these provide opportunities for us to serve patients at a higher level. And again, I want us to talk about, what's really working. Here's another, this is from a small group. These are all their amazing hygienists. And look at the impact they've had month one by offering a higher level of care to patients, right? It's amazing the impact. They're already up close to $100,000 1 month into the program. Okay, and you can see it's a variety of services that we track and measure. Many of them are preventive services that patients desperately need. And I can tell you as well that this practice's influence and effectiveness will continue to improve. Now let's talk about maximizing the schedule, minimizing all of that open time that we talked about. The 8 R's are how we do that. These are key systems that the front desk can help us with, but hygienists should be involved in all of these. These systems are recall, reactivation, recovery, referrals, reviews, retention, reappointment. All of these are critical systems that help keep our hygiene schedules full. They help keep our practice growing. They help us retain our patients. They help us retain our providers because our providers have a deeper connection with the patients that they serve. We have so many patients in our bucket that leak out because we don't have clarity on these vital systems that help support and fuel practice growth. Okay, so the next part of it is production-based compensation. Now, in my experience, when we ask a lot of our providers, and practicing world-class hygiene is so much more than just cleaning teeth, as some patients would say. We all take offense to that because we know we do so much more than that, right? But what I've seen is return on effort absolutely is required for long-term sustainable results. We do want our hygienists to earn a bigger future. We figured out how to do that. We shift our hygienists from an hourly minded employee to one that has more of an associate mindset. They recognize they're providers. They recognize they can control and contribute to practice growth by maximizing those 3 roles. And it's an amazing shift that happens when you pair production-based compensation with all of the systems to support a world-class hygienist. That's how we see such amazing growth so quickly, a combination of those 2 things. Okay, so compensation is absolutely vital, and I know it causes a lot of stress and pressure, but I want to give you a real-world case study on a practice in Detroit, low socioeconomic area, that wanted to do production-based compensation, but they were tentative, and wanted to make sure it was perfect before they implemented it. So the hygienists had knowledge on these systems for about 4 months before the practice shifted to a production-based comp model that we recommended. And I want to share with you what happened after they made that switch. Okay, so beforehand, in this location, they really weren't doing a whole lot of sealants. This was the prior year. They knew they had opportunity for sealants. They knew they could be doing more than that. And especially in a low socioeconomic area, many of their patients desperately needed it. So in a space of about 10 months, this location did about 1,299 sealants in 2022. As soon as we shifted them over to a production-based compensation model and started incentivizing them for doing the best possible care for patients, look at the difference in how many sealants they did. They went from about 1,300 teeth protected to more than 9,000 in the same time period with the same number of providers. It had a tremendous impact on the production. They went from about a $47,000 production for that procedure to 335, and in this one location, right? So the increase there was a staggering 705%. So this is key to really driving acceptance and utilization of some of these procedures and services that our patients desperately need. Okay, now this is just one example with one location, but I wanted you to see that it really does have an impact in a powerful way. Okay, now I'm going to move to the last frustration that we're going to talk about here today, and that is insurance fees being low, taking a hit on profitability. Here's some real world comments, right? I've yet to understand how we're okay accepting lower insurance fees than ever before, and frankly, everything else is inflated. You know, why can't we fix this problem, right? Dropping insurance is valid, but we often understand in our model, you shouldn't have to drop insurance to be more profitable. Here's another example. I live in an area where a hygienist with 1 year experience is getting started on a pay of 65 to 70 an hour. On the other hand, insurance fees have stayed the same and would make a prophy or exam and fluoride almost non-profitable. How do you deal with this as salaries are getting higher by the year? A very real problem. Okay, so here's our solution for this challenge. Again, insurance fees are low, profitability takes a hit. We've got to increase our profitability. And we have some clearly designed systems that can help us do that. We focus on the anatomy of an appointment. How can we maximize services to patients in the most efficient way possible without having our hygienists feel like their hair's on fire, without causing burnout and frustration? Another way that we focus on increasing profitability is same-day dentistry, both on the preventive and the restorative side. Okay, so where are you right now with same-day dentistry? Do you do a lot of it? Are you seeing much of that happening in your practices? Again, real quick, red, yellow, green. I want to see kind of what's happening. And I'm not talking here about CAD/CAM. We're talking about all things of same day. If you identify opportunity for fluoride or sealants, is it happening today? If we have a small one surface filling, are we doing it today? Right? I kind of want to see what's happening with that. And for some reason, I am not seeing the chat bar currently. Really strange. But that's okay. I'm just going to carry on because I want to make sure that we cover everything. So this is us, right? This is how we often feel at the end of the day when we don't have systems in place for maximizing our appointment time. Me trying to raise kids, exercise, excel in my work, be that world-class hygienist, not be broke, stay hydrated, get enough sleep, maintain the house, and not lose my mind. Like we feel like we're beat up most of the time. The good news is we don't have to feel that way, right? We can focus on a higher level of systems. So we do this by focusing in on appointment anatomy, both for recare visits and new patient visits. And to give you a little bit more clarity, you know, if you have a 60-minute hygiene appointment, what does that actually look like? We break it into 3 phases. The first 20 minutes is the assessment phase. The next 20 minutes is the hygiene treatment phase. And the last 20 minutes is reserved for the examination and same-day services. So systems matter. How we utilize our time matters. Being efficient with our delivery is going to help us increase our profitability. We are going to get into a lot more detail. We have the Team Training Institute holds 4 quarterly practice growth retreats every year. And the reason I have this in here, if you're interested in attending one of those retreats as a guest, our next retreat is coming up in Miami, July 12th and 13th. And the entire topic of this retreat is systems that drive profitability. And my entire presentation is going to be on the anatomy of a patient appointment, even down into the nitty-gritty, dissecting every piece, every phase of that appointment anatomy. So we're going to be getting into a lot more detail on what to do, how to do it effectively, how to do it efficiently, and how to really succeed. Okay, so Stacey, if you don't mind, could you also drop the link in the chat? It's there on the slide, but just in case people don't have their cell phone at the ready to snap a picture of that QR code, I would love to have them have access to that in the chat. And when you do that, it might actually bring my chat box back, right? So I appreciate that. Very good. So what are we seeing in hygiene every day? What does our opportunity really look like for same day? Just another day in hygiene, 19 lesions on a 13-year-old female. We have so many opportunities that we can elevate care to our patients. And we love to see our providers celebrating that. These are two amazing hygienists from Canada, sharing how they protected 10 teeth, 14 teeth in one day. The day that those opportunities are diagnosed, they're actually doing them. Dr. Camanzuli, some of our favorite people from Louisiana, Michelle, and the brand new hygienist, Abby, sharing how many teeth they're protecting, right? The impact that they had. Together, they protected 325 teeth in the month of February alone. We love that. So there's so many opportunities for us to increase our productivity by elevating patient care. Amazing group in Texas, North Texas Dental Care, and these amazing hygienists and doctor together protected 3,200 teeth in the first 9 months in the program. So there's opportunities for same day everywhere. Okay, so we focus on these systems. It's really amazing what can happen. And when we dig into efficient delivery, same-day dentistry, all of those things have a tremendous impact. So growth first year, year one, by focusing in on overcoming these hygiene challenges and implementing the systems that I've talked about, look at the difference year to date. This is a group in Alabama. Prior year to date was 2,700,000. This year, they've seen growth of over $1 million, okay? Almost 100% growth, it looks like, if I'm reading that right, maybe I'm not. No, 39% growth from the prior year to date. Okay, amazing things. What about California? You know, we always hear our practice is different, our market's more challenging. Here's another example from California, very heavily PPO areas. Collections year to date was 1.4 before working with us and dialing in on overcoming some of these systems. And year to date this year is over 2 million. So a $600,000 bump by following some of these systems that we talked about. Okay, so right now, what I'm going to do is I'm going to go ahead and stop my share. I'm not quite done. I'll bring back my slides here momentarily. And we're going to start off and have some time for some Q&A. And I really want to dig into your challenges. So Stacy, do you want to give them some insights? I don't know if you have any questions that were submitted via the chat.
Yes, so I did have a few questions come in the chat, but so I'll ask a couple of those, but if you guys have any questions, feel free to unmute and ask your questions. I would love to hear from you guys live. Or you can type them in the chat too, and I can read them out, whatever makes sense. But I thought we could start out, there were a few questions kind of about the same thing. And it was about the standard of care and integrity in hygiene, sort of maintaining the standard of care, even if insurance won't cover certain things. They're saying, you know, our patients won't accept perio, they won't accept fluoride. Do you have any guidance on that?
Yeah, I love that question. So standards of care are really critical. We teach a few things for each one of those three roles that we call non-negotiable standards of care. And I can tell you in my experience, when patients understand the why behind the services that we recommend, they often are very willing to move forward. Okay. I also find that we talk a good talk in dentistry. We say things like we refuse to allow insurance to dictate the level of care we provide. But every day in our treatment rooms, we say, they're not going to accept that. Insurance doesn't cover it. They won't do it. Insurance doesn't cover it. Or we'll tell the patient, we should probably do a fluoride today. Insurance doesn't cover it. What do you want me to do? And in that instance, we're not building value for these services, which is probably why patients aren't accepting the care. I think also, you know, I mentioned my own personal ethics and integrity at the very beginning. And, you know, we all kind of agreed that patients deserve the very best care we can give them. So we have a responsibility as their providers to stay on top of the latest research, to understand the latest science, and to see the impact that it has in our practice. You know, Stacy, real quick to answer this, I'm going to ask Bert to unmute for a second, because I know that Bert Trish has lived some of this with us. And when she first heard some of this stuff, she was able to double her production, then triple her production. So give them just maybe a couple short sentences, Bert, on how you were able to maybe disabuse your belief that patients wouldn't accept this care.
So the biggest thing I learned was when I would present this to patients, usually without building the value, without using a risk assessment to really give them a compelling why, a lot of them would look at me and go, does my insurance pay for that, Bert? And I would say no. And they'd go, well, I don't want it. Right. So what Wendy did for me in the practice when I was still a hygienist was I had the what, right? I knew what they needed. I had the why They needed it. I knew it. I wasn't communicating it very well with patients. And she gave me the how, right? And once I had that piece of the puzzle and I had a system, and now I teach that system, right, to other hygienists, it's amazing what happens the day after we leave, right, with the patients. The patients now all of a sudden own the problem because we've explained it in a way that they understand, right? Using what I call the medical model of risk assessment. Medicine has been doing this for years. Dentistry never did it. And now we use that model as part of our teaching. And when patients get it and they own it, they're willing to pay for it to fix the problem. So we tripled hygiene in a year. And all we did, guys, we didn't add any more hygienists. We didn't work any more time. All we did was change the conversation about what was happening with them and how we could help them mitigate damage from all of the habits that Wendy mentioned, right? The scale was out of balance, and you simply put them back into balance, and they start saying yes to these services. And then you start seeing the numbers that you saw in some of those charts. It was amazing to me. I never thought that it would happen. I had been with these patients for 28 years and never had success. And all of a sudden, because I had a right way to do it in a system, they changed, right? And they saw the value that we were trying to bring to them. So it's not hard. It takes effort and you have to learn it, but the tools are there. We provide the tools to be able to make you effective.
I love that. Thanks I absolutely put her on the spot and did not give her advance notice that I would be calling on her at all, but she is one of our amazing hygiene coaches within TTI. I'm so blessed and fortunate. All of our hygiene coaches are world-class hygienists themselves. So, you're able to work with people who understand the challenges that you're going through day in and day out in your hygiene department. So I love that. But next question, Stace.
Okay, so we had a couple ask about this as well. So people were wondering, if they have pessimistic people in the office, if the attitude's not very good, the environment in the office is kind of negative. Do you have any advice on how to handle sort of negative coworkers?
Yeah, culture is everything, right? So culture in a practice can really sink the entire ship if we're not careful. And we've long had a saying that you can't change people, but you can change people. So what we mean by that is sometimes when you as a doctor, as the owner doctor, if you decide we need to embrace a different mindset, I've got to get rid of some of this negativity. Often the negativity stems from their own personal frustration, maybe not having clarity on the vision. Where do we want the practice to go? And when they don't have clarity on the vision, then it's more challenging for us to get everybody on board and rowing together in the right direction. So I would say if there's a lot of negativity in your practice, it's probably a good opportunity for you to refresh or actually establish core values for your team. That goes a long way in helping you right the ship and improve your culture. And then usually with teams, they'll have certain values that they embrace and state as their core values that behavior is in conflict with. Let's say your value is teamwork or excellence. Well, griping and complaining is a direct conflict in that behavior. And so you can say, hey, listen, one of our stated core values is teamwork. And when you undermine or when you're gossiping about your team members, that actually is behavior that's in conflict with that value. How can we fix that? How can we change that? Right? So I think, it's human nature for us to complain about things that are continual frustrations. So that also is a symptom that we might need to evaluate the systems that we're employing. How can we minimize those frustrations? How can we improve the systematic processes in the team? How can we support each other better? Those are all reasons that we often find for negativity. So hopefully that's.
I have a question. Sorry, can I chime in?
Please, yes.
Sorry, and feel free, because we just had a discussion about this in one of our doctors' meeting, and one of my challenges was when patients declined, perio treatment and they want just the regular cleaning, and some of our hygienists are struggling with providing great quality work, right? And I contacted the MDA about this, and I contacted some insurances about that. Because one, we wanted to know like the legality behind it. The MDA just, they don't have like a refusal consent form, but we do, scans, we have overjet, we have the proper education, and patients are still declining this treatment and they just want to proceed to do a cleaning. But our hygienists feel like, I'm not going to do that. How do I
Yeah.
get my hygienist to understand something like that?
Yeah, so I will first start with acknowledging this is a common problem. Okay, it's a very common problem because, again, like Bert said, the patients don't have clarity on what we're talking about. The right verbal skills changes everything. We actually walk hygienists and practices through what we call a 5-step process for case acceptance with periodontal disease. And some of the things that you mentioned are part of it, making things visual, right? But there's very specific verbal skills because a lot of times we hear hygienists describe scaling and root planing as a deep cleaning. So in the patient's mind, it's no different than pulling up to a car wash. What kind of cleaning do you want? You want the basic, you want the supreme, you want the ultimate wash. And they're like, no, thank you. I'll just take the basic. I'll just take the regular, right? They're missing the fact that they've just been diagnosed with a disease. And when someone's diagnosed with a disease, how we treat them changes. It's no different than being diagnosed with diabetes or cancer, right? So how we approach this discussion, all of it has to change, okay? So we walk hygienists through our 5-step case acceptance process, where we talk about making it visual. We talk about very specific verbiage to use before you probe. We talk about all of those things, 3 things we need to do to take care of this active infection that's in your mouth. When we go through those 5 steps, we very rarely have patients that say, no, thank you, free cleaning, because they understand that they've just been diagnosed with a disease and it's not an option like at the car wash, right? So everything needs to be different with how we discuss periodontal therapy and periodontal services. That's thing 1. Thing 2, patients cannot consent to substandard care. We are still liable for supervised neglect if we allow their refusal to continue on for too long. So we never advocate that you have patients sign off on it. We don't actually recommend that you dismiss them from the practice either, but they need more time to understand the diagnosis. So we're going to keep walking them through those 5 steps, keep walking them through those 5 steps. If they decline scaling and root planing, we actually don't advocate that you do a prophy because a prophy indicates health. Instead, we recommend that you do a full mouth debridement on the day of diagnosis and continue to educate and inspire the patient to choose the treatment that they really need. Okay, we actually do have a course on this. We teach a perio explosion course. It's every quarter. I think our next one's coming up August 9th. So if you would like information about that, in just a few minutes before we close, I'm going to put a link up that you can request a call. And that's one of the things that you can request to talk about on that call is how you can get the information about our perio course, because those 5 steps are taught in that course. All the latest information about stages and grading and coding and all of that is actually also covered in that program.
Thank you so much.
You're welcome. And thank you for unmuting and asking the question live. I love when that happens. And I'm looking for my glasses because I'm seeing, Stacy, do you want to, there's a couple other questions that are coming in. Great. Great. So Vanessa says another great tool for making it visual is if you have EagleSoft, is the comparison chart for clinical attachment levels. It shows the progression of bone loss. I love the iTero scanners for that as well. And then of course, people are saying we don't do prophy for a perio patient, right? So we agree with you on that, but I do believe it's important to not dismiss right away. We put them in a holding pattern and allow our team to continue to educate and inspire them to choose the care that they need. But a holding pattern only for so long, right? They're only going to hold the plane in the air for so long. Conditions you got to eventually land the plane. So that's some of the things that we talk about in the perio course as well.
There was a question that came in a little bit ago about the schedule. Our schedule is booked too far out, and patients can't get in. What are your thoughts?
Yeah, so that's a challenge. It's both a blessing and a curse. So you're out of capacity, and that's a problem, right? So when you are out of capacity, we have a variety of things that we can help you do to overcome that capacity, but it all depends on your vision for the practice. Do you want to keep growing? What's your long-term strategy? If you're far out of capacity and you're dealing with some junky insurance plans and you don't want to grow to another location or expand your facility to address that capacity blockage, then that's when you can start eliminating some of your worst payers with insurance, right? If you do want to grow, then we have a variety of ways to do that. In the meantime, you got to put a Band-Aid on it, right? Because if you don't have any place to schedule patients, we actually help practices do what we call a hygiene blitz day, where you can catch up on overdue or unscheduled hygiene patients. It's an a well-orchestrated, well-choreographed dance that we do to get them done and see as many patients as possible on that hygiene blitz day. We switched to a model of assisted hygiene to get that done, but that's something we can help you overcome. If you are capacity blocked, that's a great conversation to have with us, because there's more than one way to solve that capacity blockage. And it really should be dependent on your doctor's end game, their long-term goal, and their vision for where they want their practices to go. That really should be determining how you handle that scenario. I'm not a fan of pre-blocking and pre-blocking out the schedule, because in my mind, that's, again, just a Band-Aid on the real problem, which is you're out of capacity. It's a great problem to have, but it's really not great if you don't solve it, right? Because you're going to have difficulty retaining your hygiene team, retaining your patients. And another common frustration is the schedule's booked out far, but then the day of, we have no-shows, open time, and cancellations. So it's really not a great problem to have, right? You've got to have systems that support the hygiene columns, all of the columns in the practice, to make sure we're maximizing the potential for all the time that we're there.
A couple of questions just came in about the same thing, so or roughly the same thing. So what is the percentage of production offered to the hygienist these days? Is there a combination of base salary and percent of adjuncts? And what do you recommend as a bonus structure for hygienists?
A really great question that does not have a simple answer, right? We have 4 or 5 different formulas that we teach, and a lot of it really depends on what your current state is now. We do not usually recommend going to a straight commission percentage. We have found that hygienists much prefer a stable hourly base with an opportunity to earn more once we're above a profitability threshold. And I can tell you, even in the same town, we can have practices that have widely variant profitability thresholds. So we take into consideration a lot of things: what your hygienist is being paid, what your benefits look like, what your write-offs look like, what your current daily average is. And we put all of those into a formula to come up with a baseline. And then usually the hygienist is able to earn a percentage above that daily baseline. And what we find is that's just the best of both worlds, right? The hygienist has the security blanket of an hourly wage, but they have the opportunity to earn a bigger future. We've recently had, probably 3 or 4 scenarios in the past year where we've had a little bit of a throwdown between the hygienist and the dentist. I would never recommend that we do this or approach it in this way, but we had all the hygienists go to the doctor and say, we're all walking unless we get X. And if you are a hygienist in one of those practices, danger, danger. Our policy is we don't negotiate with terrorists, right? That's not appropriate behavior, period. There's a different way to approach it. If you're a doctor in those practices, I would say the same thing. We don't negotiate with terrorists. But also, I think we're short-sighted when we do things like that, or when we hear hygienists saying that, I'm asking for a $6 an hour raise or what have you. And again, I said at the beginning, sometimes we need to make those market adjustments. It's not right to hire a newbie and have them being compensated at a higher hourly wage than our loyal hygienists. That's not fair, right? So we might need to make some market adjustments. But I can tell you that if you're saying, I want a $5 an hour raise, you're selling yourselves short. You can earn so much more than that with the right compensation plan. Okay, so this is where the magic happens. Having this dialed in changes everything. So that's, some of the core principles that we use when it comes to production-based compensation. And again, it is not a one-size-fits-all. I'm not intentionally being vague, but there's so much that goes into those formulas that we can't describe. Are you tracking gross production or net production? Are you looking at adjusted production? Like, all of those questions factor in to how we calculate your production-based comp package. We want to have something that works long-term for you, that's sustainable and scalable as you continue to grow. So we have to have the right answers to some of those really important questions before we can advise you on what the best formula is for your practice.
There was a question that came in a little bit ago. How do you manage to not sound salesy or pushy when you're recommending things to patients?
A really great question. I think there's a lot of people that don't really understand the approach that we teach. The solution to that is risk assessment. When we do a personalized risk assessment for our patients, all of the things that we recommend are based on where they rank their individual risk factors. Because they have that Diet Coke habit, and they've told me, I'm not giving that up. I love you, but I'm not giving it up. Then we recommend certain treatments because of their individualized risk factors. And we also teach phrases like this: my job, your job. My job as your hygiene provider is to let you know of any opportunities I see that can benefit you. Your job as the patient is to let me know what you want us to do about it and how quickly you want to proceed, right? What do you want us to do? How fast do you want to move? So everything is up to the patient. We never want our patients to feel pushed or oversold. That's not our approach at all. And the beautiful thing is they don't. They don't, because we know this. We've got some practices on here, one's on here, that we've worked with since 2007, and they've continued to grow. So if patients felt pushed or oversold, they would probably see declining numbers in practice growth, not growing numbers, right? So we have the benefit of a long time case study, several of them, more than 10 years, that we can see the long-term impact of some of the things that we're advocating and helping practices implement now.
We had a couple of questions. I'm kind of coming to the end, so if you guys have any other questions, feel free to unmute and ask. The only other thing I have was a few people are asking about coaches. So what do the coaches do? What does Coach Bert do? How much does it cost? What does training look like? Some questions like that. So if you have any guidance on some of those types of things.
Yeah, that's a great question. We love our hygiene coaches. So our program, depending on which program you choose, we have programs that start for as little as $199 a month, and of course go all the way up to full service consulting packages that probably reflect more of what you would expect to see as the price tag. But I can tell you one thing that's really unique about our programs is that they pay for themselves very, very quickly in the increase in hygiene production. Okay, I shared a few examples with you on that. The practice that was up 95,000, they paid for, more than double their annual investment in month one, right? So it really does depend on what you're trying to accomplish. And that's why I'll share my slides again here, Stacy, because I actually have some things built in for you that can help answer some of these questions. I love this quote: integrity is choosing courage over comfort, choosing what's right over what's fun, fast, or easy, and choosing to practice our values rather than simply professing them. So I wanted to kind of leave you with that positive thought. Choosing what's right for patients is really, in my opinion, fun. It's not fast or easy. It's integrity, though. And it really takes courage to choose to do something differently than you've always done. So what I want to show you is your question about how much do things cost? How does it work? It really depends on where you want to go as a practice. So what I would encourage you to do, if those were your questions, or if you'd like to know more about how we work with practices, is help us put together a plan for you. Scan that QR code. You can go to www.schedulewithtti.com and request a call there as well. There's a wealth of information on how we work with practices there for you as well. And I can tell you that our hygiene coaches, our most common programs usually are a combination of in-office coaching and in-person live events. Okay, so our coaches are the ones that go and help do the in-person on-site trainings. And they do a fabulous job. And they also help you establish your production-based compensation model. They'll help you figure out that formula and get that started day one. And then they help hold your hand and guide you all the way through. They become a really valuable partner and mentor for your hygiene team. And our most valuable programs, our most common program, the most effective, we assign a hygiene coach and a business coach for each of our practices. So really, the program that you choose depends on where you want to go and what your current scenario is. And like I said, we have a wide range of offerings for practices because not everybody wants the same thing. Not everybody needs the same thing. So the best thing to do is to schedule with TTI, get on the phone with us. We can put together a plan that helps you accomplish your goals and your vision. And that's probably the best place to start right there. So with that, I'll leave that up so that you can go ahead and continue to scan that. Hopefully that answered your question. Again, we have an online member library with a lot of resources and training materials for the do-it-yourselfers. That starts at $199 a month. It's the best deal around. But often people want more help with implementation. They want some more guidance. They want a faster return on investment. And that's why we have the amazing hygiene coaches that we have that can come and get you jump started. We call that hygiene explosion. And they spend an entire day with you walking through all of those services to really help you maximize preventive therapy in your practice. And it's an amazing experience. And we just are so proud to have worked with so many amazing practices over the years, and so proud to be invited in to the amazing practices that you've built to help in your journey. We love to be involved in your journey. So with that said, thank you for joining us tonight. I went a few minutes over, so I appreciate all of you who stuck around for the end. We would love for you to drop us any comments or questions in the chat. If you want to stay on, we'll keep it open for a little bit. And again, reach out, schedule a TTI. We'd be glad to get on a call and talk through where you are and where you might like to go. And again, if you're anywhere near Miami or would like to join us for some summer heat, I shared that code earlier, and that's also in the chat. You can have a quick call. We just do a quick call to make sure you're a good candidate to join us at the retreat, and we'd love to have you join us. So thanks again for joining us. Again, we love the fact that you chose to be here. It does take courage to make a decision, to make a change, but what got you here won't get you there. And overcoming these challenges sometimes requires a different approach and a different way of thinking. So we wish you all the best, and we hope to see you all soon. Thanks so much for joining us tonight.